Because that shortcut won't work. The video will not be opened on this. Connection on this laptop, it will not be able to open the video. Something like sir, like something like this is actually shooting.
Followed by Dr. Rajendra giving the approaches, endoscopic anatomy of the ventricles. Followed by Dr. Manmohan Singh will be describing in painted cutting the anatomy of the ventricles, surgical approaches, and then Dr. Ajay demonstrating the cadaver anatomy. And then we can have, everyone can have a hands-on endoscopy.
And the Department of Neurosurgery, especially Dr. B.S. Sharma, for giving us an opportunity to appraise you on some basic highlights on cleaning and maintenance of neuroendoscopic equipment, followed by some hands-on. And I would like to welcome Mr. Daniel Yong, who's our Global Marketing Manager, who's come from all that way from Germany to attend the program, and Mr. Surendra Mahato, who's our All India Service Manager for Karl Stores. Well, we've been always saying that is maintenance important? Yes, it is important, because at the end of the day, the equipment is expensive and it needs utmost care to really look after it. There's always an old proverb that prevention is better than cure. And as a result, the equipment is so expensive. And when we give a repair estimate, and then people feel that, wow, the repairs have gone so high, why you are charging so much? So hence the modern version says that cure is now more expensive than prevention. So we, as you treat patients with utmost care, we also take an opportunity, and as an industry, these various instruments are like patients to us, and especially the microelectronics, the digital cameras, the control units, they all need much more dedicated care compared to the hand instruments itself. Now we will discuss in brief about the various steps, how to assemble, how to disassemble, how to clean the instrument, what are the various modes of doing that. There are very small channels through which the brushes needs to go to clean the small debris which has hidden in the nooks and corner. Now, to begin with, we say that telescope is just like an eye for a surgeon. It is basically your eye inside a cavity, a cranial cavity, and showing you a good vision or good optics so that you can really do a good job onto the surgical procedure. Now, if you see the anatomy, there is an ocular lens over here, and there are various rod lenses which are situated onto this, and hence the light transmission comes from here and it is carried over here. But there is always a problem whenever we are working in a neuro endoscopic procedure. In the OR, the light is very dark, and sometimes you ask immediately the sister, please give me 0 degree, please give me 30 degree, and we are not able to know what is the angle of view of the particular scope. So we have standardized the various color codings so that it becomes easy for the paramedical staff and also for the surgeons to know what angle is there. For a 0 degree, the color coding is green on the light transmission channel, and for a 30 degree it is red. Similarly, for 70 degree it is yellow, and for 45 degree it is black, and so on and so forth. So this gives you a basic idea what telescope the sister is giving, so that it should not happen you've connected and then you find a wrong angle. So majorly what you're using is a 0 degree or a 6 degree, followed by a 30 degree, a 45 degree, and 70 degree. These are the commonly used angles over there. Now, we have seen that the instruments used in neuroendoscopic in particular compared to the other specialty, the diameter of the shafts are very small. Today we are moving from invasive surgery to minimal invasive surgery and further miniaturization of the instruments, and hence the diameters are becoming very, very small, because at the end of the day we want to achieve the basic objective of minimal invasive surgery. So whenever you ask the scrub sister to give me a scope, I have seen that normally they are handing over it like this. We are always providing a protection tube which should be put onto the scope, and it should always be kept on the table. God forbidden, in a hurry, suppose this falls down, this protection tube helps to prevent the scope. At the end of the day, the endoscopes are expensive, and once the rod lenses breaks, it becomes difficult to repair it over there, and the repairs are also very expensive. So this should always be used like this. The sister needs to give it to you in this fashion, or if this is not there, it should be handled in this fashion and given to the surgeon. Now, that's why the bending moment will not take place. Further, we are always putting some sheath in type of protecting the telescope. For example, I have a sheath here in the hand, so that it needs a space, a channel where the fluid will go, your ringle acted warm solution can go. And sometimes, we are over tightening it when we are holding in the arm, and or if the sheath has fallen, there could be small dents over here. And if the dent comes, please do not force the endoscope, just we want to push it over there. Send it to us for the repair. We have a big service center here in Delhi. We have special tools from where we can take out the dents. Because if we are trying to do that just to finish the surgery, there could be an impact on the first rod lens, and once that breaks, as I already mentioned, the repairs are expensive. So we have to check for the dents, discoloration, whether any induced chloride pitting is there onto the sheets on the normal ways. And we have special brushes which can really go into the lumen of these. These are small brushes I have seen in the OT. Normally these brushes are not available. The normal brushes are there. It is difficult to get into the channels over here. There are also small channels out here. If you see, this is an obturator of the sheath. Intentionally the channel is given so that once the surgeon is from the craniotomy side around 4 to 5 centimeters into the lateral ventricle, the CSF must start flowing out, and the paramedical staff needs to ascertain that the channel is always open. So these brushes will always help to really go and clean the debris inside the lumen of the obturator. Now, how to really clean the telescope? Normally what happens in the OT is we just use the scope, we take water, running water, and clean it like this, it's over. There are two adapters which are integrated into the light transmission place. We have to open the first adapter, then there is another adapter. Because if we do not open, and we try to open after say 2 years or 3 years, somebody tells you that needs to be open and clean, it doesn't open, and if you struggle, something can break. Because what happens, as a constant surgery we are doing xenon light source, some blood debris gets entangled here, and hence carbonization takes place over here. The light intensity that you need, once we are doing say ETV or a colloidal cyst surgery, we find once it bleeds, your vision becomes blurred and you need more light intensity. You will then realize, I don't know why I'm getting less illumination over there. The reason is we've not cleaned. In order to clean this, when we provide the telescope, there's always a telescope lens cleaner which is given. So you have to just open this is a telescope lens cleaner, and you take the other side, push it like this, and then a small paste comes. So we just take out a small paste from here, and then apply over here, and apply over here as is done. You can take one of these buds. I do not have much time to show you all the steps, but just to give an overall highlight how it is done. You keep rubbing over here, and all the 3 places. But ensure if the telescope is 2 millimeter or so, you are not putting pressure too much to rub it over here. You will find that the cloudiness, the clarity, of course we are using a sapphire glass lens over here, it becomes fabulous, and you find the optic is absolutely neat and clean. Now sometimes the telescope goes bad, and then we have a tendency to give it to unauthorized stations for the repairs because we are in a hurry. And when the optics comes after the repairs, you will find that there is a problem in the eccentricity of the alignment. Like you can see over here, the optics is not really up to the mark compared to once you do and calibrate. Today we have a service van which is standing outside the premises. That's a mobile service van which we have a facility from Carl Stores. It goes to various places and we provide on-the-spot service at your station. And after we finish this program, I'll request everybody to go, and our service manager will show you how we are able to do more steps. So this is how now what happens is there is a light cable which is connected to the telescope, and normally there are a lot of fiber bundles which are inside this. There are about 24 to 30,000 fiber bundles which are going. These are very small hair-like fiber bundle we are going, and we have to take utmost care not to really, mingle it here and there. There should be big natural force like this, and it should be protected. Because as we twist and turn, these fiber bundles will start breaking, and then a time will come you'll find you will not get adequate illumination in the cranial cavity. So how to check whether after a couple of months or years whether my light cable is really up to the mark or not? How we do it, you take this fiber optic cable in the daylight, you stand there, and then you push over here, you come here and try to see this area after you clean it thoroughly, and you will find some black spots over here. If from the company side the black spots covering an area beyond 25%, you should change your light cable, because especially in the neuroendoscopic procedure you definitely need a very high intensity good illumination inside. So this is how we check. You can also physically check, and these are the steps how to see. When you go in the light, you can see that these broken fibers are there. Now, I have seen sometimes in the operation theatre that whenever surgery is taking place and you are now changing to some other instrument, there are technicians, they feel, oh, light is getting wasted, let me just switch off the light source, let the doctor come back, assemble the instrument, and again switch it off. Please do not do this. If you do not need the light, then obviously reduce this. There's a knob here, reduce it to minimum. Now this is a xenon bulb which is inside this. It has a very high evacuation, and once we frequently switch on and switch off the light source, the life of the bulb xenon recommended from the company is about 500 hours precisely. And if we are doing it more frequently, then we are not able to give you this much of the time. And if we start the procedure with the xenon light source on, finish your procedure and then switch it off. And in case you are changing the scope, yes, definitely the light tries to come into your eyes. We are changing from 0 to 30 to 70 degree, and it should not hurt your eyes, or it should not lie on the sterile grapes, because it will burn. It is a high intensity xenon light source. It is better that we reduce the light here. One person should be always at the endovision trolley, and he should reduce and then change over. Similarly, it is important to know the various adjustments which are there in the endovision camera. We can show it later on. I do not have much time here now. Suppose we are operating and suddenly we need more light. You have increased the light intensity to the fullest capacity. Despite that fact, you still feel illumination is less. So once we know how to adjust these parameters, gain, enhancement, shutter, white balancing, everything, we are able to get very good vision over here. There are times when we have walked in the operation theatre, we've not found the vision as it should be done, and we have redone the white balancing again. White balancing is very important. How it is done, once the camera is connected, you keep a absolutely white gauze piece down. It should, the whole circle, the endovision circle should be covered with the white background, and then you press the white button for the white balancing. Because camera does not understand the colors. We have to create a white background in the memory of the camera. Then only you can appreciate true natural tissue colors that you will get in the neuroendoscopic anatomy. So that is very important. And how to adjust gain. Gain is something you adjust, increase the light intensity from the camera head buttons. Sometimes we are getting those yellow pieces. First thing is you try to knob. In the camera there are two buttons that you are seeing, two rings in fact. One is the silver, the other is the blue one. The silver is for focusing, and once the camera is focused, it will remain in focus unless you change it. The other is the zoom. So here we say that our camera is a parfocal zoom lens. That means once I have focused to the best possible image, and whether I increase the zoom or decrease the zoom, it will remain in focus area. So this is the advantage that you're getting, and from 25 mm to 50 mm of focal length, between the tissue will get the very good clarity over there. But how to do white balancing? Once again, we first make the things clear to the best possible, suiting your eyes. Put it over here. Okay. Then there is a button here. Okay. Everything should be fine, and there should be enough light. To press it, it comes white balance. Okay. There are times that sometimes the light is less, and we try to do white balancing, and it will show that white balancing dark, something like this will show. Right now it is xenon, so it is showing it. Sometimes it is half surface is the white, half becomes your sterile grapes which are green in color. So we should always ensure that the whole surface should be covered, and hence it will give you white balance. Okay. Now we were talking about the. Can you just keep your hand here? So I'll just. Okay. Now we have a certain light intensity. Now I am manipulating the screen from here. Okay. I'll go down. Okay. Now this is on the high side. You see. Now I have put the xenon on the higher side. I can also manipulate and increase the light. Now I'll show you one more. The cameras are supposed to work in the auto shutter mode, but if we want more light, there is more intense bleeding, I can come down to the manual shutter mode and further increase the light. Can you see? Now I have to really go outside to appreciate the light. So I can further, this is the highest, then the light will start reducing. So these are some of the technical points in the endovision system that you can use and hence enhance your efficiency of the surgery. So they are important. Well, normally, we are doing it, but we forget about these small things over here. The other is, there is a rotation over here. So if you are using a 30 degree, it can be rotated, and if you want to lock it, it can be also locked on the opposite side. But we always say that it should be kept open so that it is easy for you to manipulate and look into the nooks and the corners over here, and better for the camera. The camera cable assembly should always be supported like this, because if we are turning it too much upside down and things like that, there are in fact approximately 20 electric wires which are running into this. I'll show you, and all have been fixed over here, 10 here and 10 here. And if we are doing too much twisting here and there, and sometimes when we do the surgery it falls down, then this is called a card edge connector. So extreme ends will get chipped off. You still get an image, but you're not very happy. And once the wire breaks, please note, it is not possible in our service department to re-anastomose these wires. So hence we have to change the whole cable. So we have to ensure that whenever the surgery is over, there are natural folds into the camera cable, and we should use these folds and fold it like this rather than twisting it here and there. And immediately the surgery is finished, we should take this camera cap and cover it over here. And then even if it falls down, we are not in a risk. This model particular is basically a soakable camera. Today we are also marketing an autoclave camera for neuros, cardiac, spine, all these specialties. We are recommending all the instruments are autoclavable, they are reusable. You can autoclave them to the normal cycle. So hence this becomes important. We should also search physically if there are any holes, pin holes into the camera cable, because sometimes when we are putting here the light source, the light cable, the cautery lead, and we put a towel clip over here, there are chances hitting over here. So this should be ensured. Similarly, light cable also. Sometimes we are fixing the light cable and it just goes up to here, this end, and we leave it, okay, we are getting light, but this should go inside completely with an audible clip. That is very important. And the other precaution that we should take is when the camera or the light source is on, we should not be pushing it in and out. It should be off and then we should take it out. If you see this camera card edge connector, there is written up, up. So we should always keep it up and then put. Sometimes it is just left like this and then we are struggling and my camera is not working and we create a voice in the operation theater. It should be up and one should fix it up completely like this, completely going inside. Similarly over here. So these are 2-3 important features which I wanted to share with you. We've already discussed that this is something the anatomy. There are times that we are using monopolar cautery also. These instruments are very thin, and there could be chance after going through the working channel again and again that it might get ruptured from there, and then using a high frequency current can lead to short circuit. It can also give an electric shock to the operating surgeon. So whenever you have a problem like this, please refer to us. It is possible to change the whole insulation at our center. And now I'll talk about induced chloride pitting. Of course, for your department, we are always recommending autoclaving, but sometimes I've seen that sisters are putting these telescopes, the hand instruments overnight in the side X. Side X is just a disinfectant solution for 20 minutes, 30 minutes. It is not giving you 100% sterilization. And we should not treat the telescope along with the other instrument. We should have a plastic container rather than the metal container. And we always talk about a good quality water. We have very high hardness water. Now, if we show you the quality of water like this, and tell you that these are the parameters one should have in the quality of water, it is not possible to get. So at least we say it should be demineralized water and at least drinking quality water. Then only it makes more sense of putting it over there. Now, once the instruments has induced chloride pitting, why it takes place? It takes place as a matter of corrosion. Now, how can we avoid this type of corrosion? If you see all these instruments, they are 450 alloy steel with nickel chrome plating, and we have a silver coating over there. If you are able to retain this silver coating, please note, corrosion will not take place. Now, normally what happens, the instruments are just cleaned and then kept it. It is very essential to dry these instruments. And one should use the hair dryer. Absolutely, drying is very important, and then you should fix it up. You should always disassemble, then dry it. And how to do a periodic cleaning into this so that the induced chloride pitting doesn't take place. We have a product called Duraglit. This Duraglit has some swabs in this with the silver content. If I take out this can be done once, depending upon the workload that you are having. If you're not operating every day, it can be done once in a fortnight or once in a week or something like that. And I take this and then start rubbing. Okay. So this will allow to retain its silver content, the silver polish onto that, and then very, very minimal chances of induced chloride pitting. And if you have that type of instrument which has got induced chloride pitting, then obviously one should not, use that instrument. One should really plan to change the instrument over there. Otherwise, there is a contagious disease, contaminated disease from one instrument to the other instrument. And there are special, valves where the brushes cannot reach. So I've shown you a couple of brushes which are here, we can reach. Then there are hand instruments, you can appreciate. These are very fine instruments for the neuroendoscopic work, for the cranial work, and they need to be oiled. So once we have cleaned, we need to now oil them so that you should not feel after some time that it is becoming stiff, it is not opening, I'm not able to take a biopsy. Now we are providing a special pen dropper. If you see the anatomy of that, it has a spring-loaded action. Normally I've seen sisters are putting some oil, paraffin and all that. You should use the medical grade silicone oil, and it is not possible to really reach there. If you see this, we have already filled it with the oil, and I am going to be using this spring-loaded action, and a very precise drop of the oil is going to come and lubricate in this channel. Okay. So once you press this, you see the oil has come. So you are wasting less oil, and then it does the work what to do. All moving parts should be lubricated. Then there are something called as lure locks. These are lure locks. We have a tendency that we forget to open these because nobody told, but we should always open this, clean. There are threadings which are done, they get worn out as a result because they have not been opened any time. Then there is a special grease, as we use the grease on the cycle chains, and it keeps it very fine in moving. So we have a grease here for these stopcocks, and with using these type of gadgets, it really enhances the life expectancy of your instrument. It just becomes fabulous. You feel that I have bought and I've been using it from past 10 years and 15 years like that. So with this grease, you come out here, a precise drop can be taken and just keep it very smooth. So all these places where the threads are there, one can use the grease very comfortably and then reassemble it back again. Similarly, there is a channel here, one can also go. So all the instruments with the moving part needs to be put oil, and the threads needs to be greased over there. These protection tubes are very, very important. Always, all the neuroendoscopy equipment or the fine optics should be used with this. You can really imagine that if it falls, the rod lenses are going to break. So this becomes very important to use the protection tube. Now, whenever the surgery finishes, sometimes we do not have time to really clean it. Then obviously now various different gadgets have come in the market. This is the ultrasonic cleaner. It works on the vibration modes. So once you push your instrument into this, please note a word of precaution. We cannot use the telescopes and the camera heads out here because they have to be treated differently. Once you put the cleaning agent into this and it starts vibrating, it will clean your blood which has got and the debris in the nooks and corners of the instruments. So you can use these gadgets. Similarly, The blood debris getting over here can be cleaned over there. The instrument have to be dismantled. I have seen once the instrument comes from the OT after the surgery, nobody opens these knobs. These knobs have to be opened, these screws have to be opened, you have to dismantle and then clean it. Then only you have a better access. Sometimes we are using drills, we are using EC motors for. There are areas where we do not open and you find this type of corrosion taking place, hence the equipment gets back. So we have to open and clean it thoroughly. At times, these instruments are sometimes long and we forget to get the proper sterilization trays for that. So we have small trays, we try to dump things and they can lead to cracks, and then working with this could be disastrous for the patients. So a proper regular health checkup is required, and if you have any problem with the equipment, of course there would be some wear and tear. We are not saying that once you get the equipment it is a lifelong, but if we have these gadgets with us, small little gadgets for cleaning maintenance, it enhances the life. And otherwise we have our own service center where we can repair at the component level. We have a service manager, the whole team is there, so you can always refer it to us and we can do it. We always say sterilization is no substitute for cleaning. So hence this is a cycle that we say, once we receive the equipment from the theater staff, we dismantle it, do a cleaning, either mechanical or ultrasonic cleaning with these fine brushes, should go into the lumen of this, then rinse this, dry it, then lubricate, then assemble it, and then go for storage. So these are certain sprays where you can also put your oil through these on the EC motors. And today new modalities of sterilization have come in the market. Gas plasma sterilizations, these are slightly expensive in nature, and you can see the parameters which are required for sterilization. So these are the gadgets for that. Now these are the various steps, whatever we have discussed, that how we have to follow the different steps and then do a proper cleaning and maintaining. And we say that try and fix up a responsibility. Now there are about 10-12 OT staff which are working and helping you out. If we initially train 1 or 2 persons, the paramedical staff, and they learn about the equipment, and then gradually it should be passed on. It cannot happen that everybody is not trained and one stop. And then once you fix up the responsibility, then he really ensures that everything is working properly and it serves your purpose when you are over there. Now this is another pistol on the top. This has got a lot of value, especially in a bigger institute where the workload is very high. We fix this pistol on your wash basin over there, and then there are different nozzles. So once the water is coming, it comes with a very fast jet. So we can also use a decalcifying agent which can be put into the area on the knob, and it comes through the decalcifying agent, and you can really reach with water jet nooks and corner, and fast cleaning can be done, and you are ready for the next surgery in the operation theater. So these gadgets can always be ordered from us. Their part numbers are there, and this really helps to clean it. And in big institute we fix it up on the wash basin, and it really helps the department to fasten your procedure. Now there are always been talking, I bought a camera I used for 2 surgeries or 1 surgery, it is not working. Always these questions are coming. The fact is, we do have a lot of voltage fluctuations in our country. Hence, we are recommending that people should use a voltage suppressor. Now what is a voltage surge? We find that it's written 220 volts, 230 volts at 50 hertz of frequency. But whenever there is a sudden rise in the voltage, it could go to 440 or even 800 volts for a micromillisecond. It may be sufficient to damage the microelectronics there. These days it's all microelectronics, it can damage the PCB over there. So how do we protect this? Now in order to protect this, we are recommending a spike protector. Now what is the job of the spike protector? When the voltage is coming from the main line, we put 2 capacitors here, and we know that the electricity follows the shortest possible route. So we put the 2 capacitors, the high surge or the voltage which is coming for a micromillisecond, then turns out through the capacitor and grounded down, and it does not reach your equipment. So once we have a UPS which is there, I'll show you the connection from the main ACs. We take a UPS. The best would be a UPS online. You can use a UPS offline. You can use a CVT. So it comes through the UPS. From the UPS output, we connect a spike protector or a spike surge suppressor, and from here we start connecting the electronics, which could be a camera, a light source, and it could be a suction irrigation apparatus. Then we are safe. So these gadgets can be bought. They are not very expensive as well. So this is how we do. Now sometimes people ask that I bought your equipment, now what should be the rating of the UPS that I need to install it? We've learned in physics that the power is voltage to current, and we have a cost factor which is 0.86. So whatever is the VA, that you multiply by 0.86, and hence you can calculate what would be the wattage power required for that particular equipment.